Hi there. I'm Ian Wheeler. I'm a homeopathic pharmacist and I've had my own pharmacies for 30 years. I've always had a passion for natural medicine and having done 3 years of classical homeopathy, designed the Pegasus range of homeopathic remedies for ease of use by you as professionals, front shop staff, and particularly the layperson with a young family who wants a more natural approach to healing and keeping their family healthy. As a pharmacist, I'm often asked, why bother with homeopathy? You have a whole range of drugs within your business. Why would you bother with homeopathy? And I'm going to enlighten you on that. First of all, I believe we are created very powerfully. We have an innate healing ability, and this is where homeopathy works. On an energetic level, it stimulates that innate healing ability of the body, and it treats not just cause, but not just symptom, but cause as well. So, for example, our sting remedy it has a broad application. It does not just the bee, the wasp, the jellyfish, the obvious ones, but severe sunburn or a hot water scald, a baby with bad nappy rash. It's going to heal in half the time. Very safe with allopathic drugs. So homeopathy is very complementary. It's not an alternative modality. It is safely used with allopathic drugs, and I use it in my pharmacy all the time to wean patients off of antidepressants, anti-epileptics, if it's applicable, but particularly over-the-counter drugs like painkillers, antihistamines, and sinus remedies. I will give it in conjunction for 2 or 3 days and slowly wean the patients off. Big one, it's safe in pregnancy. Because Pegasus works with pretty high potency, there's no measurable molecular mass of substance to cause an anaphylactic reaction, an allergic reaction. Therefore, totally safe in pregnancy while the mom is breastfeeding and the newborn infant. It is safe for babies and infants from birth. They can't overdose. Twice, 3 times a week, I'll get a mom phoning me frantic. The child has consumed most of, if not all, the contents of the bottle, their little inert sugar-based pilules, and happily I can tell her no harm is done. The child will have a sugar overload. They'll be hyperglycemic for 20 minutes and go ballistic, but no harm is done. I'd like to now just show you briefly, introduce you as to how homeopathy works. You might have heard of the saying, like cures like. You all heard of arnica for bruising, swelling, bleeding. If we take the Arnica montana plant, we macerate it, we mash it up, steep it in alcohol for a period of time, it will draw out a dark, foul-tasting liquid, which is the mother essence, the mother tincture of that herb. If all of us in this room had to consume that orally, you will present with sore, stiff muscles. You'll look as though you've been beaten black and blue. You'll be bruised, and you will have bleeding from your gums, possibly other internal bleeding. So it's actually poisonous to us. However, if I produce a homeopathically attenuated arnica from that tincture, it will cure exactly those symptoms, like cures like. The other example would be the allium cepa. You've all cut a red onion in your kitchen. What happens? Your eyes start smarting, nose starts running, you possibly sneeze, burning, lacrimation. Therefore, the allium cepa in homeopathic potency would be found in my hay fever remedy or the cold and flu remedy, where you expect those symptoms to present. So as a homeopath, yet another advantage is you don't need to know the etiology, the cause of the illness. You just have to know your remedies and match the correct remedy to the presenting symptoms, and homeopathy sends energetic messages to the body to initiate the healing response. You'll see on the remedies they have a potency, a C designation of a potency, or a D. We use mainly the centesimal. It's the potentization of the remedy that has been the most effective over time. So for example, we would take 1 ml of that poisonous substance. If we go back to the arnica, take 1 ml of that poisonous substance, dilute with 99 ml of alcohol. We would succuss it 100 times. We bang the remedy against something. This scientifically is proven to put into the water alcohol mixture the chemical structure of the original substance. Once that is succussed 100 times, that would be a 1C. It is now homeopathic, but very close to the original poisonous substance. Of that, we would take 1 ml, dilute with yet another 199 ml of alcohol, succuss another 100 times, that becomes a 2C. And if we repeat that serial dilution and succussion 6 times, you'll have a 6C arnica. Pharmacologically, that's pretty dilute. But in homeopathic terms, it's still considered low potency. We use that low potency where we want quite a strong physiological action. For example, in a hay fever or in an injury where we want an anti-inflammatory action. If we repeated that 30 times, that would be a medium potency where Pegasus works mainly. A very nice balance between physiological action to the symptom, but also constitutional healing. It's starting to heal the cause of the illness as well. 200C and above would be considered pretty high potency, very good for emotional application, and where you are very assured of your remedy from a constitutional point of view. Pegasus is a combination of remedies. This is known as clinical homeopathy. If I deal with you on a classical way, as a classical homeopath, we are trying to find the one single remedy that attends to your individual personality. We all have individual personalities and an independent constitution. I, for example, am a tuberculinum. I don't have TB, but my forefathers 100 years ago did have tuberculosis. Syphilis, gonorrhea, tuberculosis were common illnesses, and how genetically 100 years later, how the illnesses present. It's called miasmatic theory. So if I get really run down, that little cough that you typically heard now would come to the fore. I would take one dose of a high potency, a 1M or a 10M tuberculinum, and it lifts my whole essence of who I am, and my constitution is lifted, and that's how homeopathy works. But that is very time-consuming, knowledge-based. We don't have that time or knowledge, particularly in the retail environment, or the young mother at home doesn't know that. So Pegasus is simple, easy to use. If all of us in this room took a sinus remedy, 97%, it'll work for all of us. Our independent bodies will see and take out of the remedy that which is pertinent to us as individuals. So the success rate is high. So for example, in the Pegasus range, take our injury remedy. It spells out, it tells you exactly what the remedy is for, and the name of the remedy appears on the top of the bottle. It's very simple. In an emergency situation, a child falls off of a bicycle, you can just grab the injury remedy and it's going to heal the physical symptoms and the emotional symptoms. Pegasus generally works with higher potencies than most of the other over-the-counter homeopathic remedies in retail. And I just feel in the modern world we live in, the pace of life has sped up quite tremendously. So at 30C, you're going to get a rapid response to the symptom and a healing of the cause as well. So in an acute situation, the body tends to use the remedy up quite rapidly, so you would dose initially frequently, but the high potency resonates well, and both symptom and cause are healed. We're going to talk about the dosing of homeopathy. Dosing, you cannot overdose, which is a huge advantage, as I said earlier. So a dose, whether it's a newborn infant, a cat, a dog, a horse, an average size human being, is 3 to 5 pilules. I normally tell my patients, aim for 4 pilules into the cap, not into the hand. The women generally have got nice smelly creams and fragrances. The men, petrol oil, we don't really want to know. So rather from the cap into a clean mouth. Meaning avoid ideally 20 minutes before you take the remedy, peppermint, coffee, toothpaste, any food or drink with a strong taste or an odor, because this is a very subtle remedy. You want it to be absorbed. It is absorbed in the buccal mucosa of the mouth. So with homeopathy, it's not the number of pilules you give. It is the frequency of the dose, because each dose is a message to the body. It's not a drug. You're not giving a drug. And that's why 4 or 5 pilules will work for a child, a newborn infant, or a man, even a horse. So you want to initially dose frequently, rather dose too frequently than not frequently enough. As soon as you see a positive response, then you slow the dosage down and stop once you're well. So dosing with homeopathy is quite adaptable. It depends on how the symptoms present as to how you're going to dose. So with dosing, for example, in an acute situation like a panic attack or a sting, you're going to dose every 15 minutes 3 times, half hourly 3 times, and then every 2 to 4 hours until well. When you're well, you stop. In a general case of dosing, for example, a pregnant mother with cold and flu, the symptoms are not as acute as the panic attack or sting, then you would dose hourly 3 times, every 2 hours 3 times, and every 4 hours until well. Should you be dosing with more than 2 remedies? We don't advocate you do more than 2 remedies at a time. It's very important to alternate the remedies. You're sending a very high potency complex message to the body, so you don't mix the remedies together, you alternate them. For example, the mucodrainal sinus, we use that combination because they're very synergistic. The mucodrainal would thin the thicky sticky mucus, allowing the sinus remedy to do the decongesting. You would alternate them half hourly for 2 or 3 doses of each, then hourly for 2 or 3 doses, and then possibly you might do them once or twice a day, but have a 20-minute gap between them. Dosing children, same as for adults, because it's a message to the body. They enjoy the pilules, they're sucrose pilules, there's no lactose, and I must just reiterate, once the child is well, you stop dosing. The symptoms may reoccur 2-3 weeks later, 2-3 months later, but they'll be half as intense. You do the same process again. Each time you dose, you are healing the constitution, you are healing the cause of the illness. Just a practical application. Should I have a mother with a very colicky baby? She's going to need to dose before the feed, after the feed, between the feeds. And crushing pilules in a newborn infant, they can't suck the pilules until they're about 8 months old. Prior to that, totally safe, you would crush 4 or 5 pilules between 2 plastic spoons, add a little water, and then give it into the mouth. But if you're dosing that frequently, crushing pilules to a busy mom can be problematic or an irritation. You can dissolve about 10 pilules in half a glass, a whiskey tumbler sized glass of water, spoon the solution or syringe the solution into the infant's mouth or a dog or a cat's mouth. It works equally well. And you would just change that solution after 12 or 24 hours. Diabetics, there are sugar pilules. There I would say be more specific, only 3 pilules at a time. But remember, this is designed for acute conditions. We shouldn't be taking the remedy for more than 3 to 5 days, and you reduce the frequency as you respond, so the slightly elevated blood glucose far outweighs the beneficial effects of the remedy. Just a little feather in Pegasus's cap. I designed the remedies in 2002, and in 2004, Professor Wayne Derman took Pegasus as his complementary range to the Olympic Games. They won't give an elite athlete an antiprostaglandin drug like a Voltaren, an anti-inflammatory, in the first 24 hours of an injury, because allopathic drugs act against the body. They actually inhibit the natural body response. But they well gave our injury remedy with fantastic results, because it works with the body, it reduces the inflammation, the swelling, the trauma, but healing the body at the same time. So within 24 hours, having used the injury remedy, they would then well include the anti-inflammatory to then accelerate the healing and complete it. Very important for athletes in that it's not detected in doping tests. So quite safe for the elite athletes to use homeopathy. There are no side effects. They are not illegal in any way. No drowsiness, will not affect performance. When I teach the final year pharmacy students, as a practicing pharmacist who's embraced homeopathy, they will listen to me. And once I explain that homeopathy has, at certain levels, no actual measurable molecular mass, they will challenge me quite often and say, well, then it's purely placebo. And I will then challenge them back and say, explain to me why a newborn infant, a dog, a cat, a horse, the entire symptomatic picture changes dramatically within 2 or 3 doses. And that pretty much gets them thinking in the right way. I would now like to tell you about the Pegasus range, about the remedies within the blue box. There's a picture of our little blue box, all 28 remedies. They're 10-gram vials of 50 doses per vial, so that's enough for 2 or 3 episodes of a condition. There's also a first aid antiseptic solution, consists of colloidal silver, calendula hypericum, very soothing, very healing. Colloidal silver is antiviral, antifungal, antibacterial. The box retails at 900 Rand, which sounds like a lot of money initially to outlay. But if you consider the remedies don't expire, divide the 29 remedies by that amount of money, it's just over 30 Rand a remedy. The box can be refilled, so once you've bought it, it's forever. and a really useful thing to have at home. It's like your pharmacy in a box, but invaluable for a young family or anybody that travels. You're away from your pharmacy, away from your doctor. You've got all your remedies that never expire. Should they run out, you go back to your local pharmacy health shop. You can buy the bigger remedy. It's 150 doses, 25 grams, and refill your bottle. You've got that individual remedy for everyday use. It's a popular remedy for that family. Let me run through the remedies and tell you what they're all about. The first remedy, antispasm, you can see it's a high potency remedy because I feel with a baby with severe colic, it's just an immature digestive system. At that potency, you're going to get the constitutional healing, and the colic is a thing of the past quite rapidly. But the beauty of homeopathy, it does any form of spasm. With allopathic drugs, you're taking a different drug for a bronchospasm, yet another drug for a stomach cramp, a menstrual cramp, or a leg cramp, or four individual remedies. The antispasm, the Pegasus antispasm, will do any form of cramping. We have very good results with restless legs, normally in older patients, but athletes as well. I will use this remedy very often with a patient who's had an injury. They'll use our injury remedy, plus the alternate with the antispasm for that the spasm that the body has gone into. The second remedy is antivirobac 200C. This is a full-blown antibiotic without the negative connotations of the allopathic antibiotics. It has no sods of penicillin, streptomycin, staphylococcus. So we've taken those antibiotic cultures, we've homeopathically attenuated them, and they send messages to the body to initiate a healing response, an appropriate immune response for viral or bacterial infection. If a patient is allergic to penicillin, no problem. At that potency, there's no measurable molecular mass that will cause an anaphylactic response, an allergic response, so quite safe. But very useful at the earliest convenience or threat of an infection. So the child walks in, the snotty nose becomes yellowy, greeny. That instead of going to the doctor, take the antivirobac, give it 48 hours, dose hourly 3 times, 2 hourly 3 times, then every 4 hours. And in that window period, if the child's condition has stabilized, they will get well and they will build up an immune system. Should the patient within a 48-hour period not respond appropriately and the condition worsens, they immediately should then consult an appropriate practitioner, their GP or a homeopath. The next remedy, arthritis and gout, 30C. This is for acute inflammatory pain and gout. I always do the holistic approach with my patients, make sure they're drinking enough water, fresh lemon in the water, eating correctly, cut out the carbs and the sugars, but give the remedy frequently while it's acute, less frequently once you're healed. In the case of a gout sufferer, they are intrinsically gouty until they change their lifestyle and their eating habits. Once they're over the acute attack, they're still gouty. They could take 1 dose a day on a more chronic regime to maintain the gout, and I've even managed to wean patients off of allopathic drugs by using the remedy. The bites remedy, the bites 30C, this remedy hopefully won't often be used by patients, but should they eventually be struck by a serious bite, a spider, scorpion, snake, or a dog, this is the remedy of choice. I was teaching in Namibia, and Dr. Bass and his son are ENTs there, but in the Namib Desert has the highest incident of snakebite, or in fact poisonous things, centipedes, scorpions in the world. And talking to Dr. Bass about the remedy, he listened, and then suddenly he was doing a talk at the same symposium I was at, and the next minute this very slide came up, and he said the best remedy for snakebite is car keys. You get in your car and you drive as fast as you can to the nearest hospital. However, in Namibia, big country, a lot of those farmers are an hour and a half or more away from the closest town. So he really embraced this remedy because even though this is not an anti-venom, it has snake venoms, tarantula, the spider venom in it, and scorpion venom. It will slow down the degradative processes of the disease, buying you more time to get to professional help. I would also suggest alternating this remedy with the trauma rescue shock, because the patient is generally going to go into a bit of shock. The next remedy you see is a low potency remedy, boils and abscesses 6C. The reason it's low potency, when the body is trying to get rid of a poisonous or toxic substance, it's going to form a carbuncle or a boil. It's trying to push out of the body that substance, and the silica, the key remedy in this remedy, is known as the homeopathic surgeon. It will excise morbid matter like pus or even a foreign object. So we wouldn't give this remedy to someone for more than about 5 to 7 days should they have a prosthesis or nuts and bolts in their body. But very successful for pustular cystic acne and recurrent boils. I see patients getting them in the groin area or in the armpits. So very useful remedy. If there is a chronic boil episode, I would alternate this with the antivirobac, which is our antibiotic. The next remedy, bronchial relief, pretty straightforward. Chest conditions, wet cough, dry cough, very effective for my asthmatic patients. I see them coming to the pharmacy, buying the salbutamol pumps, Ventis, Astavent, etc. too frequently. Every 2 weeks or so, I would introduce this remedy in conjunction, and within 2 weeks or less, that pump is lasting 4 to 6 weeks, as it should, because the remedy is helping the chest function as optimally as it possibly can. The calming remedy, 30C, lovely remedy as a general calmative. Some people just have angst in their stomach, butterflies in their stomach, but very useful for exams, students writing an exam. They can focus, it doesn't make them drowsy, it's not habit forming, giving a speech, wherever there is going to be some anxiety. It's also useful even in panic attacks, which is a very acute form of anxiety. The patient needs to have the remedy with them, and at the earliest warning sign of that, a trigger of the panic attack, take a dose every 10 to 15 minutes, and within 2 or 3 episodes you'll find the patient suffers less and less, or less intense, because it's healing the reason why. Cold and flu, 30C, pretty self-explanatory. It covers all the aspects of cold and flu, the body ache, the runny nose, the fever. It works with the body though, and helps the body use the fever as a healing tool. Very nice for your hypertensive patients, patients on other medication where they are very limited with the over-the-counter drugs, which have antihistamines that could interact adversely with their allopathic drugs. Very safe, of course, for pregnant moms, a winter remedy. The constipation 6C remedy, a low potency remedy. It has a laxative effect, but it's very gentle, nice for pregnant moms, your newborn infant. But what it really does, it reconnects the brain bowel reflex. So if someone has a lazy bowel, it's going to reinitiate that. If someone's chronically constipated, give them a natural laxative, make sure they're drinking enough water, give this remedy in conjunction, and it will normally restore a natural bowel motion. Very useful when traveling. The next remedy, cystitis 30C, a common affliction in women, especially when they're pregnant. The burning, frequent urination. When they go, it's scanty and not much urine. Do the holistic approach. Give the citrus soda or a urinary alkalinizer with this. Drink enough water. Highly effective remedy. Fluid imbalance, 6C, low potency remedy, because if a patient has got edema, this remedy will act as a diuretic. It will get rid of the water. Very useful, mainly my female patients flying long haul flights. They get swollen ankles. This sorts it out very rapidly. And conversely, should the patient, an endurance athlete, be dehydrated, or a child has had bad vomiting and diarrhea, it will then, you give the same remedy. It then helps the body hold on to the fluid and distribute to the critical organs of the body. So a perfect example of how homeopathy will only ever do to the body that which should happen, and in the most optimal way. The gastric plus remedy, one of my favorite remedies. It's where there is mental angst and anxiety that impacts on the gut, resulting in acid reflux, heartburn, indigestion, flatulence, bloating, low-grade nausea. So the key remedy in here is argentum nitricum, which is for anticipatory anxiety that results in tummy upsets. The child, for example, will come to the mom and say, I can't go to school, I've got a sore tummy. In the meantime, they're worried about not having done homework, or there's a bully at school. I will always use this remedy in conjunction with the antispasm remedy, alternate them for the irritable bowel and spastic colon. Very, very good results. Even adjunct to ulcer treatment, useful remedy, especially when you're traveling. The hay fever, 6C, low potency remedy, because hay fever is a very physiological, snotty episode, sneezing, streaming eyes, very unpleasant. Dose frequently, and not only will it treat the symptoms, but in time the hay fever sufferer will build up a tolerance and not get hay fever as frequently. The headache remedy. Headaches are difficult to treat. They're not easy. If someone walks into my pharmacy with a full-blown headache, I generally will give them a painkiller. However, if I hear from them, they get either a migraine, we do a migraine as well, or the headache more than once a week or 3 or 4 times a month, something in the body is out of balance, then I would suggest they take the remedy first thing in the morning, irrespective of having a headache, have the remedy with them at the very earliest prodromal warning sign of the impending headache. They would dose every 10 to 15 minutes, and very often by the third dose it's either gone or very much subsided. If not by the first or second episode, by the third episode the headaches are often a thing of the past. Histamine comp, that's our homeopathic antihistamine. The key remedy there is rust tox. Rust tox is made from the poison ivy. You touch an poison ivy plant and you will get a rash that mimics exactly chickenpox. Vesicles that are watery, stinging, itching. So give this to a child with chickenpox, they will heal in half the time. Also very successful for shingles. I will give this remedy alternating with the injury remedy because it has the hypericum. With shingles, it's a hypersensitization of the nerve endings of the skin. I've seen patients not even able to wear clothing if this has taken hold. So alternate the injury, this remedy, and add L-lysine, which is an amino acid, and you rapidly treat the shingles. But the keynote of this remedy is itchiness. Itchy skin, itchy eyes. It will not make you drowsy, won't cause a dry mouth like a normal antihistamine. I will often, in fact, give it to a patient that is chronically on allopathic antihistamines and wean them off, because this helps the body build up a tolerance to whatever the presenting antigen is. Dogs with dry skins, very, very successful also. Immune defense 30C, I designed this remedy specifically for the creche syndrome, where little children are going to preschool play groups, so they have cauldrons of viruses and bacteria. Homeopathy can't really be used preventatively. It needs a symptom to act upon. But in that high risk situation where they're exposed to a lot of viruses and bacteria, homeopathy, in this case immune defense, modulates the immune system. It doesn't overstimulate, it brings the immune system back to balance. So even very useful for autoimmune situations, HIV positive patients, this remedy is valuable. They won't easily succumb to secondary bacterial infections. This is one of my favorite remedies, injury 6C. It's a low potency remedy. We want an anti-inflammatory action, but you will see if you read the booklet that we put out, the arnica is at 200C, because remember arnica in the raw could precipitate bleeding, so you would never normally give arnica low potency before an operation. You may well precipitate bleeding. But with arnica 200C, it still has a very good anti-inflammatory action, but it is also a very good shock remedy. The hypericum, one of the other remedies, also at 200C, is the arnica of the nerves. So you've slammed a finger in a door, dropped a heavy article on a toe, a whiplash, spinal injury, dental surgery, concussion. Brilliant, brilliant remedy. But one of my favorite uses is in birthing. It is the finest birthing remedy. We always try and promote natural birth, but should the mother end up having a complication and a cesarean, the hypericum, once again, you're cutting a very nerve-rich area, it will heal in half the time. The next remedy is called liver 30C. It does the obvious cirrhosis, hepatitis, jaundice, even bubulus, but I use this remedy mainly for business stress. The key remedy in it is nux vomica. It is a very powerful liver remedy, but the typical A-type personality who is spinning around doing 5 things at once eventually burns out a little bit. They can't prioritize. They come home, they're irritable, out of character, can't sleep properly. They need alcohol to go to sleep, coffee to wake up. This remedy is brilliant. Just 1 dose in the evening before dinner, and it helps them prioritize and makes their life a lot easier. The next remedy, migraine, we did mention earlier. Just to mention that whenever we give this remedy, a migraine is different to a normal tension headache in that there is the visual disturbance and the nausea. It's very debilitating. We always alternate the fluid imbalance. We find there are hormonal remedies also related to the migraine remedy. It attacks more women than men, and often they are dehydrated, even though they say they drink water. But the fluid imbalance ensures that, and the results are enhanced tremendously. Mucodrainol is probably our biggest remedy. It's for that thicky, sticky, snotty mucus that is produced. And you know, you produce mucus because it's the body's means of encapsulating viruses and trying to expel them. But obviously, if it gets lodged in the sinus cavities, the ear, the eustachian tubules, young children from a newborn to 5 years old are very prone. It's painful, it causes congestive pressure, and that's where your infection will set in as well. So if you can drain the mucus, thin the thicky, sticky stuff, you're more than halfway to healing the patient. However, we will always mention the sinus remedy in conjunction with this, because as the mucodrainol thins the thicky, sticky mucus, the sinus remedy will decongest, stop that hawking, that postnasal that people get. Very useful combination. NVD 30C, brilliant traveling remedy. I'll never travel without it. A patient that's really nauseous, you can't give them a tablet, they're going to spew it up. Whereas the little pilules are easy to suck and well absorbed. It also deals with the china in the remedy will also deal with dehydration, so it's a lovely traveling remedy. Nausea, vomiting, diarrhea. The sinus remedy, that's our second biggest remedy to mucodrainol, and I often suggest taking it in conjunction with the mucodrainol. If the patient says they can't afford both remedies, I will always ask them, are your ears involved? If they are, you give the mucodrainol. If not, give the sinus. I will often give this time in the September, October, when the allergies are rife, often sinus is allergy induced. The patient is allergenic, produces mucus, and of course that causes the congestion and the pain. Then alternate the histamine and the sinus. Very, very successful in both acute and chronic sinusitis. We mentioned alternating the mucodrainol and the sinus. We don't like to give more than 2 remedies in a case, but there's one scenario where I will. The mom will come to me, the child's had grommets fitted, the little draining tubules in the ears. When this happens, that child has got a severe historical upper respiratory history. And there, the mother will come to me, say the child's had grommets fitted, already 2 or 3 sets of antibiotics this year, it's starting again. There's a discharge, it's yellow, there's an odor, there's trouble coming, they don't want yet another antibiotic. They can see the downward spiral of the child's health. I would, in that case, introduce a third remedy, being the antibiotic, the antivirobac. Line them up, alternate them, and if you alternate them in the first 12 hours frequently, the results are very good. I even have an ENT up the road from my pharmacy that prescribes the mucodrainol sinus for kids where grommets have been fitted. They don't get the secondary bacterial infections. Our sleep remedy, lovely remedy, it just unwinds the busy mind, trying to re-establish a sleep pattern. I personally sleep well at home, thankfully, but when I travel, I'm in a foreign place, a foreign bed, funny noises, and I'm busy. I will tend to wake up between 2 and 4, that typical nux vomica type of syndrome. I will then take the sleep remedy, just do the meditative breathing, and I will wake up with the alarm. Normally, I will wake up before the alarm, so it works really well. Works particularly well for children, where their little minds are sponges. They're absorbing a lot of information, very busy, as are we as adults. Excellent, no side effects, not habit forming. I also want to mention I use the remedy in conjunction with a herbal sleeping draft that we produce in the health shop. In the pharmacies, there are other herbal sleeping remedies which you can use in combination. In elderly patients, I will add a third item, being a calcium and magnesium, to wean patients off of benzodiazepine sleeping tablet addiction. We'll give those 3 remedies. I call it my sleep trio: the sleep Pegasus Sleep 30C, the calcium and magnesium, and a herbal sleeping draft in combination, in parallel with their sleeping tablet for about a week. Then slowly reduce the sleeping tablet over a period of weeks, and it's very successful. The next remedy is the Sting 30C, very multifaceted. It doesn't just do the bee, the wasp, the jellyfish, the blue bottle. It is for mosquito, spider, and flea, and it helps the body to build up a tolerance. So if someone is really allergic to bee and take this remedy, by the second or third episode, they start building up a tolerance and are no longer no longer react so badly to the bee sting. They build up a tolerance. But it has a broad application. Any stinging or burning sensation, sunburn, hot water scald, nappy rash, as I did say earlier. Lovely remedy. The teething pain and fever, excellent remedy, because remember, homeopathy works with the body. The key remedy in here is chamomilla. It's known as the opium of homeopathy. A teething child is clingy, they're restless, they're pretty unplayable. Give the remedy, they calm down, and the natural painkillers make the whole teething episode fairly non-episodal. And also for fevers, remember the body is very clever. It produces a fever for a very good reason. It's that whole interferon process to kill viruses. So you don't want to give the Panado, the Stopain, or the Ponstan too rapidly. Have it in the cupboard. Should the child be on this remedy and the fever did spike to 39 degrees, then I would give the allopathic drug. But the remedies in the teething pain and fever will work with the body, with the fever, use it as a healing tool, and the child will build a wonderful immune system. The throat remedy, a lovely remedy. I have the patient coming into the pharmacy with a sore throat. We give them a gargle, give them a throat lozenge. A day or two later, they're back. It's got worse. They're swallowing razor blades. Invariably, they'll say to you, I think I need to see a doctor. I'd probably need an antibiotic. I don't really want to see the doctor. This is your throat antibiotic. It's got nosodes of penicillin, streptomycin, and diphtherinum, plus all the anti-inflammatory remedies. Very successful. Again, give it 48 hours, hourly, 2 hourly, 4 hourly, and it normally 95% sorts that sore throat out. If not within that period, see your doctor. This is one of my favorite remedies, trauma rescue shock. You all know rescue remedy for shock and anxiety. I've just elevated it to 200C, so this is actually 10 times normal rescue remedy, because rule of thumb with homeopathy, the more emotional the application, the higher the potency you want to go. So I've added aconite for shock. I've added injury, the arnica at 200C, because it's very good for trauma. If the patient's been mugged or in an accident, they're in emotional shock, but they're physically traumatized, and it deals with both aspects. But the key remedy would be ignatia. Ignatia is the grief remedy, and the worst shock I think a human can encounter is death in a family, animal or human. And it works very, very well. The patient deals with the grief in a real way, but a manageable way. Very, very good. A nice application is also separation anxiety. We even use it for drug addicts, and sadly in the Cape Flats there's a tick and heroin addiction, and these drug addicts, even though they're on methadone to wean off, their psyche is that a sense of loss of self when they give up the drug, and by giving this remedy they let go more easily. In retail environments you're not going to hopefully see much of that, but you'll have patients wanting to give up cigarettes, give up smoking, highly addictive. Give them an anti-tobacco remedy. Natura makes one, in fact, but with our trauma rescue shock they will let go so much more easily. Another very good application is the young mother. In this economy, mom and dad are generally both working. She has the baby, bonds beautifully in the 6 months, has to go back to work. The child goes to a carer or to creche. A very, very hectic separation anxiety, and this remedy helps both mom and child. So it's a remedy everyone should have in their handbag or cubbyhole of the car. Animals respond very well. Thunder, lightning, any traumatic experiences. Good remedy. The last remedy, VMT, vertigo, morning and travel sickness. I don't know why they call it morning sickness. Most moms suffer the whole day, but very, very good. Very successful. Totally safe in pregnancy, because morning sickness occurs in the first couple of weeks of pregnancy, and we don't like to give drugs in the first trimester, but this is totally safe. Also for travel sickness, we sell a lot of the remedies to patients going on cruises. They spend a lot of money on these cruises. They're on holiday, they're generally drinking alcohol, and if you give the allopathic drugs with alcohol, they sleep through most of the trip. Whereas This will not make them drowsy. They enjoy their trip. They get their sea legs very successfully. It's also for Meniere's disease and vertigo. Tinnitus, some good results there as well. The final remedy being the antiseptic solution in the blue box. It's colloidal silver, calendula hypericum, very soothing, very healing. It doesn't necrose the surrounding skin. We even use it on coral cuts, which infect overnight, very successful. You can put a couple of drops in water and gargle with it. Colloidal silver has both bacterial, fungal, and antiviral action. So that's a lovely remedy to round up the box. So finally, that rounds up all the 28 remedies in the blue box. For me, a really invaluable little box to have for particularly a young family. It's like your pharmacy in a box. Particularly at home, you'll save many doctor's visits, but when you travel, it's invaluable. They never expire. You can refill them, as I said earlier. And just as for example, as a pharmacist of 30 years, still practicing, my own boys are 24 and nearly 27. They've had one antibiotic in their lives, and they used to, from the age of 11 or 12, go to this box, help themselves. You can do no harm. It's easy to use. You can't overdose. And so, yeah, every home should have one.